Estradiol Insert is a medication that contains estrogen and is used by women to reduce vaginal symptoms of menopause, such as vaginal dryness, burning, and itching. These symptoms occur because the body produces less estrogen during menopause. When treating only vaginal symptoms of menopause, it is recommended to use products that are applied directly inside the vagina, like this medication. Estrogens that are taken by mouth, absorbed through the skin, or injected may have greater risks of side effects due to more estrogen being absorbed. It is important to use this medication as directed by your doctor and to discuss any concerns or questions with them. The typical dosage is usually once a day, and the best time to take it is usually at bedtime. Before you start using Estradiol Insert, it's important to read the patient information leaflet and instructions for use from your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. When handling the insert, make sure to wash and dry your hands. Then, find a comfortable position for vaginal insertion. Hold the insert with the larger end between your fingers and place it about 2 inches into your vagina as directed. Your doctor will usually recommend using this medication vaginally once daily for the first 2 weeks, then 2 times a week, every 3 to 4 days. The dosage will be based on your medical condition and how you respond to the treatment. It's important to use this medication regularly to get the most benefit from it. To help you remember, mark the days on your calendar when you will be using this medication. Do not increase your dose or use this medication more often or for longer than prescribed. If your condition does not improve or if it gets worse, make sure to inform your doctor. Some common side effects of Estradiol Insert may include nausea/vomiting, bloating, diarrhea, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to contact your doctor. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as mental/mood changes, lumps in the breast, unusual changes in vaginal bleeding, increased or new vaginal irritation/itching/odor/discharge, signs of liver problems, swelling hands/ankles/feet, or symptoms of high blood sugar. In rare cases, this medication may cause serious, sometimes fatal, problems from blood clots. Seek medical help immediately if you experience symptoms such as shortness of breath, chest/jaw/left arm pain, unusual sweating, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, sudden/severe headaches, trouble speaking, weakness on one side of the body, or sudden vision changes. If you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Estrogens, whether used alone or with another hormone, can have serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogens should not be used to prevent heart disease or dementia. Estrogens can increase the risk of cancer of the uterus. Taking a progestin as directed by your doctor can help decrease this risk. If you experience any unusual vaginal bleeding, be sure to tell your doctor right away. In postmenopausal women, estrogens, taken with or without a progestin, can increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used along with a progestin, estrogens can also increase the risk of heart disease. The risk for serious side effects may depend on the dose of estrogen and how long it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Be sure to discuss the use of this medication with your doctor and check in with them regularly, such as every 3 to 6 months, to see if you still need to use this medication. If you will be using this medication long-term, you should have regular complete physical exams, as directed by your doctor, such as once a year. See also Notes section. It's important to inform your doctor or pharmacist if you are allergic to estradiol or any other medications, as well as if you have a history of blood clots, high blood pressure, certain types of cancer, mental/mood disorders, diabetes, heart problems, kidney or liver disease, or thyroid problems. It's also important to avoid smoking or using tobacco while taking estradiol, as it can further increase the risk of certain health issues. If you are planning to have surgery or will be immobile for an extended period, it's important to discuss this with your doctor, as it may affect your use of estradiol. Additionally, it's important to inform your doctor or dentist about all the medications and products you use, as well as to avoid prolonged sun exposure and use sunscreen when outdoors, as estradiol may cause blotchy, dark areas on the skin. If you wear contact lenses, you may experience vision problems while using estradiol, so it's important to contact your eye doctor if these issues occur. Estradiol should not be used during pregnancy, and it may pass into breast milk, so it's important to consult your doctor if you have questions about using this medication while breastfeeding. It's important to be aware of potential drug interactions when using Estradiol Insert. Some medications, such as aromatase inhibitors, fulvestrant, and tamoxifen, may interact with Estradiol Insert, affecting how it works. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential risks. Additionally, Estradiol Insert may interfere with certain lab tests, potentially leading to false test results. It's crucial to inform lab personnel and all your doctors that you are using this medication to ensure accurate test results. If this medication is swallowed, it can be harmful. In case of an overdose and you notice serious symptoms like passing out or trouble breathing, it is important to seek immediate medical help by calling 911 or your local poison control center. Symptoms of an overdose may include severe nausea/vomiting and unusual vaginal bleeding. It's important to not share this medication with others. Make sure to keep all your regular medical and lab appointments. You should have regular complete physical exams including blood pressure, breast exam, pelvic exam, and screening for cervical cancer, pap smear. Follow your doctor's instructions for examining your breasts, and report any lumps right away. Consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help to reduce your chances of heart disease and stroke. It's important to make lifestyle changes such as reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking. Keeping your mind active with mental exercises like reading and solving crossword puzzles can help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. If you forget to use Estradiol Insert at the scheduled time, use it as soon as you remember. If it's close to your next dose, just skip the missed one and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. It's important to store Estradiol Insert at room temperature and away from light and moisture. Do not refrigerate it or store it in the bathroom, and be sure to keep it out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.